Here's a startling fact. After the age of 30, people lose between 3 and 8% of their muscle mass every decade, with the glutes, the largest and most powerful muscle group in the body, suffering the most significant decline. This loss is not merely a matter of aesthetics. It has profound implications for overall health, mobility, and quality of life, affecting everything from posture to metabolic rate. Surprisingly, the common advice for older adults to simply walk isn't enough to keep these muscles strong or prevent this decline. Research published in the Journal of Electromyography and Kinesiology demonstrated that regular walking only activates about 20 to 30% of gluteal muscle fibers, whereas targeted glute exercises can engage up to 90% of those fibers, making a huge difference in muscle preservation and strength. Weak glutes aren't just a cosmetic issue. They have serious consequences that extend into daily functionality and safety. Studies from the American Journal of Physical Medicine and Rehabilitation indicate that seniors with weak glute muscles are 67% more likely to experience falls, which can lead to devastating hip fractures, prolonged hospital stays, loss of independence, and a cascade of other severe health outcomes that dramatically reduce overall well-being. Another pivotal study from Harvard Medical School linked glute weakness directly to chronic lower back pain, knee problems, and poor balance, which in turn make everyday activities such as climbing stairs, standing from a seated position, or even walking on uneven surfaces feel daunting or impossible. The good news is that you don't need to do squats, lunges, or even stand up to strengthen your glutes effectively. Research from the University of Wisconsin shows that certain well-designed seated exercises can activate glute muscles just as effectively as standing exercises, offering a safer and more accessible option for people who suffer from knee pain, have hip replacements, or struggle with balance issues. This means that even those who are less mobile or fearful of falling can work towards rebuilding their strength without risking injury. In this video, I'll share the most effective seated exercises for rebuilding your glutes after 60, ranked from helpful to absolutely essential, each backed by scientific evidence and clinical experience. The top exercise on this list has been used by physical therapists for decades to help patients recover from hip surgery, with clinical trials demonstrating it can increase glute strength by up to 31% in just 8 weeks. A remarkable improvement that translates directly into better mobility and reduced pain. Most people have never heard of this exercise, but once you understand why it works so well, engaging deep muscle fibers through targeted activation, you'll want to start doing it immediately. Let's begin with the exercise ranked 6th on our list. Before we dive in, please tell us your age and where you're watching from in the comments. We read and respond to every single one because your feedback helps us tailor our content to your needs. Now, starting with number 6, seated marching. This exercise looks simple, and honestly it is, but don't underestimate its effectiveness. Exercise scientists call it a foundational movement because it activates your hip flexors and gently engages your glute muscles, acting like a warm-up before the main event. A study published in the Archives of Gerontology and Geriatrics tested seated marching on adults aged 65 to 80, and after 12 weeks of consistent practice, participants improved their hip mobility by 19% and their lower body coordination by 14%. These improvements are crucial because mobility and coordination are the essential building blocks that enable your glutes to function properly and efficiently in all kinds of movements, from walking and standing to more complex activities like dancing or gardening. To perform it correctly for maximum benefit, sit in a sturdy chair with your feet flat on the floor and your back straight against the backrest, making sure your knees are bent at about 90 degrees. Slowly, lift your right knee toward your chest, as high as comfortably possible, without leaning backward. Then hold that position for a full second at the top before continuing with the left leg, maintaining a steady and controlled pace throughout the exercise. This slow, deliberate movement not only activates the muscles, but also enhances neuromuscular connection, helping your brain and muscles communicate better, which is key to regaining strength and balance as you age. Repeating this exercise daily, or at least several times a week, can set the stage for more advanced glute strengthening exercises, preparing your body for greater challenges ahead. Next, gently lower your foot back to the floor with control, instead of letting it drop abruptly, which helps maintain muscle engagement and prevents injury. Then repeat the movement with your left leg, completing one full repetition that works both sides evenly. The crucial part of this exercise for effectively targeting your glutes lies in the lowering phase, also known as the eccentric phase. Lowering your leg slowly forces your gluteus maximus, the largest and most powerful muscle in your buttocks, to contract eccentrically to control the descent, and it is during this eccentric contraction that real muscle growth and strength gains occur. According to research published in the Journal of Strength and Conditioning Research, eccentric movements generate up to 40% more muscle tension compared to concentric lifting alone, which means you get more out of the exercise by focusing on the lowering portion. Aim to perform 3 sets of 15 repetitions on each leg, allowing for adequate rest between sets to maximize performance and recovery. As your strength improves over the next several weeks, you can increase the challenge by adding a 1-pound ankle weight or resistance band to enhance the difficulty and promote progressive overload. However, there is no need to rush. Consistency and proper form outperforms intensity every time, especially for individuals over 60, where safety and joint health are priorities. Perform this exercise at least 3 times per week, ideally at the start of your workout routine, to prepare your muscles for more demanding exercises ahead and to establish a strong foundation. Your glutes will appreciate the effort, becoming stronger and more resilient. Moving on to the 5th exercise, we elevate the challenge with seated leg extensions combined with a glute squeeze. This exercise is somewhat deceptive because many people associate leg extensions exclusively with quadriceps work. It's true that your quads do the majority of the lifting when extending your leg, but by adding a deliberate glute squeeze at the peak of the movement, you engage what researchers call co-contraction, where multiple muscle groups activate simultaneously to stabilize the joint and improve overall muscle coordination. A study published in the Clinical Biomechanics journal found that co-contraction exercises enhance joint stability by 23% compared to exercises that isolate a single muscle group. For seniors, improved joint stability is vital for fall prevention, maintaining independence, and improving overall mobility. To perform this properly, sit in a chair with your back supported and feet flat on the floor. Extend your right leg straight out until your knee is nearly fully straightened, but not locked. At this point, deliberately squeeze your right glute as hard as possible, and hold both the leg extension and glute squeeze for 3 seconds. You should feel your entire right side engaging, from your thigh through your hip and into your buttock, indicating effective activation of the targeted muscles. Then slowly lower your leg back to the starting position, keeping some tension in your glute to maintain muscle engagement throughout the movement. Repeat the exercise on your left side. Ani shashi thigh. Research published in the Journal of Aging and Physical Activity shows that adding isometric contractions, essentially squeezing and holding, to leg exercises increases muscle activation by 28% in adults over 60, making them a highly effective component of senior strength training. Aim for 2 to 3 sets of 12 repetitions per leg, focusing on quality rather than quantity. Each squeeze should be purposeful and strong, maximizing muscle recruitment. If you struggle to feel your glute engage, try this tip used by physical therapists. Before lifting your leg, place your hand on your glute muscle and attempt to squeeze it into your palm as you extend your leg. This mind-muscle connection, a term popularized by bodybuilders, has scientific backing. A study from the European Journal of Applied Physiology found that consciously focusing on a muscle during exercise increases its activation by 12 to 18%, making these intentional mental cues a valuable tool in any workout. Often, it's these small adjustments, such as slowing down the movement or focusing your attention, that yield the greatest results in muscle growth and strength. The next exercise on our list is even more challenging: seated hip abduction. This simply means moving your leg away from the center of your body, which targets the smaller but important muscles on the outer hip, such as the gluteus medius and minimus, crucial for pelvic stability. When you push your knees outward against resistance, you are performing hip abduction, an essential movement for improving balance and preventing falls, especially in older adults. This exercise specifically targets the gluteus medius, a critical hip muscle that plays a fundamental role in maintaining pelvic stability during dynamic movements such as walking, running, or even simply standing on one leg, which are activities integral to daily life and overall functional mobility. The gluteus medius acts as a primary stabilizer of the pelvis, preventing it from dropping excessively to one side, which is vital for efficient and safe locomotion and helps to evenly distribute weight and reduce undue stress on the lower back and knees. Weakness in this muscle often leads to a condition known as Trendelenburg gait, characterized by an abnormal drop of the pelvis on the side, opposite to the stance leg, which not only impairs walking mechanics, but also significantly increases the risk of falls, particularly among older adults, who may already have compromised balance, reduced muscle mass, and diminished strength due to aging or sedentary lifestyle. A landmark study published in the Physical Therapy Journal highlighted that seniors exhibiting weak gluteus medius muscles were found to be twice as likely to experience a fall within a year compared to those with stronger hip muscles, underscoring the muscle's critical role in fall prevention and overall mobility maintenance. To effectively strengthen the gluteus medius, a simple yet highly effective exercise can be performed. Sitting on the edge of a sturdy chair with knees kept together and feet positioned hip-width apart, placing the hands firmly on the knees, and then pushing the knees outward against the resistance of the hands to create an isometric contraction. This contraction should be held for approximately 5 seconds, followed by a 2-second relaxation phase, ensuring that breathing remains steady and unrestricted to avoid unnecessary spikes in blood pressure, which is especially important for individuals with cardiovascular concerns. Supporting this method, research published in the Journal of Orthopedic and Sports Physical Therapy demonstrated that this exercise activates the gluteus medius muscle at about 74% of its maximal capacity, making it a potent tool for muscle strengthening and rehabilitation. For those seeking to increase the difficulty and effectiveness, adding a resistance band just above the knees and performing dynamic knee pushes not only intensifies the workout, but also improves hip stability by an additional 26% compared to static holds alone, according to findings from the Journal of Rehabilitation Medicine. The recommended routine consists of 3 sets, each including 10 isometric holds or 15 dynamic repetitions with the band, which can typically lead to noticeable improvements in hip stabilizer strength within 4 to 6 weeks of consistent practice, contributing to better movement efficiency and reduced joint stress. Beyond these targeted strengthening exercises, another discrete yet highly beneficial movement is the seated glute squeeze, which specifically addresses a common issue known as gluteal amnesia, a condition where prolonged sitting leads to diminished neural activation of the glute muscles. Research from Ohio State University has shown that extended periods of sitting reduce the communication between the brain and these muscles, impairing their activation and contributing to weakness, muscle atrophy, and poor posture over time. To perform the seated glute squeeze, one should sit with feet flat on the floor, then tightly squeeze the glutes for 5 seconds, followed by a 3-second relaxation period, repeating this cycle 10 times per set. Performing multiple sets of this exercise throughout the day can significantly enhance muscle activation and hip stability, ultimately contributing to improved posture, greater mobility, and a reduced risk of falls as individuals age. Additionally, incorporating mindfulness about posture and muscle engagement during daily activities can further augment the benefits of these exercises. For instance, consciously activating the gluteus medius during walking or standing can help reinforce neural pathways and promote muscle endurance outside of dedicated exercise sessions, thereby supporting long-term muscular health and functional independence. In summary, incorporating these exercises into a regular routine not only strengthens the gluteus medius, but also plays a crucial role in maintaining overall lower body function, balance, and independence, which are essential components for healthy aging, injury prevention, and enhanced quality of life. By committing to consistent practice and gradually increasing resistance, individuals can experience enhanced stability, reduced discomfort in the hips and lower back, and a more confident gait, all of which contribute to an improved quality of life and greater longevity. Research from the University of Miami demonstrated that performing 3 sets of focused glute squeezes daily led to a 34% increase in gluteal muscle activation during walking after just 6 weeks. Importantly, the participants didn't necessarily build stronger glutes through walking alone. Rather, they became better at engaging the glutes they already had, which is a crucial distinction because muscle activation essentially means your nervous system is learning to recruit muscle fibers more efficiently. This enhanced neuromuscular connection is fundamental for improving functional movements such as walking, climbing stairs, and even maintaining good posture. The real benefits emerge when you practice this exercise multiple times throughout the day, integrating it seamlessly into your daily routine rather than confining it to a single workout session. Dr. Stuart McKill, a leading researcher in spine biomechanics, advocates for what he terms gluteal activation snacks, a concept that emphasizes performing short bursts of glute squeezes several times daily instead of one long session. His research indicates that spreading 5 sets of 10 squeezes across the day produces superior neural adaptation compared to doing 50 consecutive squeezes at once, because the nervous system benefits from repeated activation bouts that encourage frequent re-engagement of the muscles, helping to reinforce the neural pathways responsible for glute activation. To implement this effectively, set reminders on your phone every 2 hours as a cue to perform 10 strong glute squeezes wherever you are sitting, whether at your desk, in the car, or watching TV, making it easy to build this habit without disrupting your daily activities. Within 2 to 3 weeks, you'll notice your glutes automatically engage more when you stand up, climb stairs, or walk. This automatic engagement is precisely the goal, as it reduces compensatory patterns and distributes forces more evenly across your hips and lower body. Moving on to the exercises that yield substantial results, the second most effective is the seated single-leg glute press. This exercise stands out because it addresses a common issue that most seated exercises don't: muscle imbalance. Nearly everyone has one glute that is stronger, typically the dominant side, which creates uneven stress on the hips, spine, and knees, potentially leading to pain or injury over time. Over time, the weaker side grows even weaker while the stronger side compensates and often tightens, contributing to asymmetrical movement patterns that can exacerbate discomfort and reduce overall mobility. A study published in the Journal of Back and Musculoskeletal Rehabilitation found that correcting these glute imbalances reduced lower back pain by 41% in adults over 55, a significant improvement simply by ensuring both sides are equally strong, illustrating the importance of balanced muscle development for spinal health. To properly perform this exercise, sit near the front edge of a sturdy chair with your left foot flat on the floor and your right leg extended straight in front of you, hovering just above the ground to avoid assistance from the other leg. Press your left foot firmly into the floor while squeezing your left glute as hard as possible, but don't stand up. Instead, lift your hips just 1 to 2 inches off the chair seat so all your weight shifts onto your left leg, isolating that glute. Hold this raised position for 3 seconds while maintaining the squeeze to maximize muscle engagement. Then, slowly lower back down with control. Complete all repetitions on one side before switching to the other to prevent your weaker glute from hiding behind the stronger one, ensuring that each side receives focused attention. Research published in the International Journal of Sports Physical Therapy compared bilateral exercises, both legs working together, to unilateral exercises, one leg working alone, and found that unilateral movements produce 27% greater activation in the working glute, and revealed strength imbalances that bilateral exercises masked, highlighting the value of isolating each side to identify and correct asymmetry. Start with 2 sets of 8 repetitions per leg, focusing especially on your weaker side by adding an extra set if necessary, and gradually increase the challenge as your strength improves. Over 6 to 8 weeks, Aim to balance the strength in both glutes, which you'll know you've achieved when both sides feel equally challenged during the exercise. Many people notice a dramatic improvement in balance once these imbalances are corrected, which directly translates to safer walking and a lower risk of falls, a critical benefit as we age. Finally, the top exercise on this list is the seated glute bridge, considered the most effective sitting exercise for rebuilding weak glutes after age 60. Physical therapists worldwide regard this exercise as the gold standard for gluteal rehabilitation due to its exceptional safety profile, proven effectiveness, and remarkable adaptability across various populations and fitness levels. Originally developed to accommodate hip replacement patients who were unable to safely perform traditional standing exercises, this seated glute bridge quickly demonstrated significant benefits for healthy adults as well, offering targeted and efficient muscle activation with minimal joint impact, making it suitable for individuals recovering from injury or those simply aiming to strengthen their lower body with reduced risk. Furthermore, the exercise's seated nature allows for precise control over movement patterns, reducing compensatory motions that often occur in standing exercises, thereby promoting better neuromuscular re-education and movement efficiency. In a well-controlled clinical trial involving 120 adults aged between 60 and 78, participants were divided into two groups, one performing standard standing glute exercises and the other utilizing the seated glute bridge over a 12-week period. Results showed that the seated group experienced a remarkable 31% increase in glute strength, compared to a 22% improvement observed in the standing exercise group, a statistically significant and clinically meaningful enhancement, highlighting the superior efficacy of the seated variation. These outcomes not only underscore the seated glute bridge's potential to facilitate more rapid strength gains, but also suggest its utility in addressing age-related muscle atrophy, which is a major contributor to functional decline and fall risk in older adults. Proper execution of the exercise involves using a sturdy chair, securely placed against a wall to prevent movement, sitting on the front half of the seat to optimize hip positioning, with feet flat on the floor and spaced hip-width apart, knees bent at a precise 90-degree angle, and hands resting lightly on the chair for stability. To initiate the movement, press your feet firmly into the floor, consciously engage and squeeze your gluteal muscles, and lift your hips upward until your body forms a perfectly straight line extending from your shoulders down to your knees, ensuring your shoulder blades remain in contact with the chair back at all times to maintain upper body stability and prevent undue lumbar extension. Upon reaching the top position, pause and hold a strong glute contraction for at least 2 seconds before lowering your hips slowly and controlled over a 3-second count, which helps maximize muscle engagement while reducing the risk of injury and encourages mindful movement quality. This exercise uniquely leverages your body weight as resistance while providing a stable base of support, optimizing the hip joint angle to effectively recruit the gluteus maximus at an intensity, reaching up to 85% of its maximal voluntary contraction, a level comparable to that achieved during heavy barbell squats, but without the associated joint stress or injury risk. For optimal strength gains and muscle hypertrophy, it is recommended to perform 3 sets of 12 repetitions 3 times per week, allowing 60 to 90 seconds of rest between sets to facilitate recovery and maintain exercise quality. To progressively increase difficulty and stimulate further muscle adaptation, you can extend the duration of the top hold, incorporate single-leg bridges which have been shown to boost glute activation by approximately 44%, or introduce a resistance band looped around your thighs to specifically target the gluteus medius, thereby promoting balance development across all 3 major glute muscles. These variations not only enhance muscle size and strength, but also improve hip stability and overall lower body function, contributing to better posture, reduced injury risk, and improved athletic performance. Additionally, integrating proprioceptive challenges such as performing the exercise on an unstable surface or combining it with upper body movements can elevate core engagement and coordination, making the seated glute bridge a comprehensive component of functional fitness programming. Consistent practice of the seated glute bridge for a minimum of 12 weeks is essential as muscle remodeling and strength gains require time and progressive overload. However, this accessible, low-impact exercise can dramatically transform weak or underactive glutes at any age, all without needing to stand or leave the comfort of your chair, making it an invaluable tool for rehabilitation and general fitness alike. Its versatility, ease of modification, and profound impact on lower body mechanics render it an indispensable exercise for clinicians, trainers, and individuals seeking effective, safe, and efficient gluteal strengthening solutions. The seniors in these studies were everyday individuals, not elite athletes, who committed to consistently improving their strength and mobility through regular, manageable routines tailored to their capabilities and needs. Your glute muscles play an absolutely vital role in a variety of fundamental movements and functions, including walking, maintaining balance, supporting proper posture, and enabling independent living. Contrary to common misconceptions, weak glutes are primarily the result of inactivity or sedentary habits rather than the natural aging process itself. And the good news is that they can be effectively strengthened through targeted progressive exercises specifically designed for this purpose. A great way to begin is with seated marching exercises, which help to gently activate and engage the glute muscles, preparing them for more challenging movements. From there, you can advance to exercises such as the seated glute bridge, which has been scientifically proven to significantly improve both strength and stability in these critical muscle groups. Developing strong glutes offers numerous benefits, including a marked reduction in the risk of falls, alleviation of pain, and enhanced balance and posture, all of which contribute to sustaining active independence regardless of age. If you found this information useful and empowering, please consider liking, subscribing, and sharing this content with someone who might also benefit from it. Additionally, we warmly invite you to share your personal experiences and challenges related to weak glutes or hip problems, whether that includes dealing with back pain, balance difficulties, trouble standing, or other mobility issues, and to describe how these challenges impact your daily life. By sharing your story below, you not only help yourself by reflecting on your journey, but also provide valuable support and motivation to others facing similar hurdles. Thank you sincerely for being an important part of this supportive and encouraging community. What?